Everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today, I want to talk about Medicare and Medicaid credentialing. Medicare and Medicaid are both federally run programs in the United States. Medicare insurance is usually offered to individuals who are 65 and older, or if they're younger than 65, they have an approved disability stating that they're basically unable to work, and they go onto the Medicare program earlier than 65. Medicaid is for lower income individuals. It is not usually a permanent or long-term situation such as Medicare. And even though Medicaid is a federally run program, there are individual funds allocated to each individual state in the nation, and each state is responsible for running their own Medicaid programs. Medicare, again, just because they're a federally ran program doesn't mean that this isn't kind of similar as Medicaid. You are broken into different jurisdictions for Medicare. It can get really complicated, and I have some videos going over that in more depth if you want to check that out. But Medicare is facilitated by administrative contractors that are set up by jurisdiction. So you might have like 12 states that have the same Medicare administrative contractor, or MAC that we call them. And that might be a specific MAC for just parts A and part B. There could be a different MAC for home health versus hospice versus DME. And again, that's where we're kind of getting into the weeds. So just know that Medicare and Medicaid are both federally run programs through CMS, Centers for Medicare and Medicaid Services. It is overseen by DHS, the Department of Human and Health Services. And you will get to know this, if you don't already, as you work with Medicare and Medicaid in your practice. If you're not familiar with your local Medicare administrative contractor, if you're not familiar with your local state's Medicaid program, all you need to do is go into Google. You can say, what is the Medicare administrator for Medicare programs in Oregon, California, Florida, whatever state you're in, and it should be able to tell you which jurisdiction and what the name of it is. There's about 5 or 6 different MACs, I believe. And then you can also just put in the state Medicaid, so Florida Medicaid homepage or something like that, and it should bring it up for you. In Oregon, it's its own title. The department, the Medicaid program is its own. Oregon Health Authority is through that, the Medicaid program. So I know that because that's my local state. And every state's going to be a little bit different. I believe Florida is like Sunshine Health or something like that. And you'll get to know it. Every Medicaid program is going to have you credential your providers individually through them. It's not through the government, it's through the state's program for Medicaid. Every provider who's going to be seeing Medicaid patients and wants to bill Medicaid for reimbursement has to be first credentialed and approved by the insurance company. This has to be done before you can see patients, before you can bill Medicaid. They have to give you their stamp of approval that you are good enough to participate with Medicaid, especially in your specialty, in your focus area, etc. Because sometimes if it's through an MCO, like a managed care organization in your area for Medicaid programs, they might say, oh, we have too many practitioners or providers in that specialty, in that area, and we're not going to approve you. Or maybe you've had some criminal or malpractice issues in the past, they're not comfortable approving you for credentialing. And in that situation, you would be excluded from the program, okay? So credentialing for your local state Medicaid is done through your local programs. Google it, find it. And you can even go to Google and put provider enrollment for Oregon State Medicaid or Medicaid provider enrollment. These are the keywords, provider enrollment. Anytime you're looking up credentialing and contracting with an insurance company, just a hint, go to Google, put provider enrollment and the name of the insurance company. So provider enrollment for the state of Washington, provider enrollment for District of Columbia Medicaid, or something like that. And then you should be able to find it pretty easy. They usually make it pretty straightforward, giving you the instructions, contact information, the application if you need to do a paper application or an electronic form of the application, or if you need to create a login to a portal and complete it that way. They might use CAQH, but it will explain it to you. You just have to make sure that you're reading the instructions fully, you understand what it's saying. Credentialing with Medicare is a little bit different. They kind of beat to their own drummer, if you will. Usually, in order to become credentialed with Medicare, you also need to make sure that you're enrolling yourself with some kind of entity, whether it's on your own as a sole proprietor, if it's through a group that's existing, or a new group that you're going to want to also enroll. And you do this all electronically through the PECOS portal, PECOS. Some people call it PECOS, but everything for enrollment for Medicare, credentialing and contracting, it's all done through the PECOS website. I have videos about how to set up your login credentials for PECOS, but just be aware that you're using the same login credentials that you use for the Identity and Access Management System, or the INA system, and where you applied for your MPI 1 and MPI 2 for your group if you have one. Those login credentials are also used for the PECOS website. So you have one set of credentials that's used on 3 different websites, and they're all managed, maintained, obtained from the INA, Identity and Access part of that portal. And then they're used in the MPPES system, which is for MPI numbers, and PECOS. Again, there's no real contracting with Medicare because you know what rates you're going to get reimbursed based off of the nationally published physician fee schedule that CMS puts out twice a year, and you always have access to it in their website. And I actually put a link in the video description to the physician fee schedule for CMS so that you can see it. But there's no contracting because there's no negotiating, and the rules, regulations, laws about billing Medicare programs is widely known. It's out there, it's on the CMS website. And so there's no real contract. You basically credential through the PECOS website for both your individual providers and your groups. You have to get groups enrolled. They don't call it credentialing, they call it enrollment. So provider enrollment, group enrollment, and you get them all enrolled. And then once they're approved by your local MAC or Medicare Administrative Contractor, then you're ready to go and you can start billing for Medicare services offered to Medicare beneficiaries. So just be aware that the difference is Medicare and Medicaid, even though they're both federally supported programs, they're both kind of locally maintained, locally administered through jurisdictions. For Medicare, it's like regions that are broken into, and they're called Medicare Administrative Contractors. For Medicaid, it's each individual state. And that's how you apply for the credentialing, is through the individual state program of Medicaid for your individual providers credentialing, and then you contract with your groups. And PECOS, you don't really do contracting, but you do enrollment for Medicare for your individual providers and the groups. Okay. I know there's a lot of confusion there, but hopefully this helps you kind of understand. It's a big federal umbrella. They're broken into separate little pieces based off jurisdiction or state. And then Medicare is all online through PECOS for enrollment. Medicaid is however the individual state requires the credentialing and contracting to take place. But credentialing is the most important first step for individual providers and enrollment so that they can be recognized and officially approved by either the Medicare and or Medicaid programs in those local jurisdictions or states so that the providers will be able to see patients with those insurances. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. Take care of yourself, and we'll see you next time. Bye-bye.